Welcome back to Thorani, I'm Joe B. In this video, I'll be showing you how to palpate the most superficial first layer muscles of the plantar foot. Let's dive in. There are three muscles that are most superficial and are therefore collectively called the first layer of the plantar foot. These are the abductor hallucis, flexor digitorum brevis, and abductor digiti minimi. The abductor hallucis originates from the medial process of calcaneal tuberosity, flexor retinaculum, and plantar aponeurosis. It inserts at the great toe base of the proximal phalanx. It is innervated by the S1, S3 medial plantar nerves and provided blood flow by the medial plantar arteries. It performs first, metatarsophalangeal joint flexion, abduction, and longitudinal arch support. The flexor digitorum brevis originates from the medial process of the calcaneal tuberosity, plantar aponeurosis, and intermuscular septum. It inserts at the middle phalanges 2 to 5 and is innervated by the S1, S3 medial plantar nerve. It's provided blood flow by the medial and lateral plantar arteries. And it performs 2 to 5 metatarsophalangeal flexion, as well as supporting the longitudinal arch of the foot. The abductor digiti minimi originates from the calcaneal tuberosity and plantar aponeurosis. It inserts at the base of the proximal phalanx of the fifth toe and is innervated by the lateral plantar nerve from S1, S3 and provided blood flow by the lateral plantar artery. When it contracts, it performs fifth metatarsophalangeal flexion and abduction, as well as support of the longitudinal arch of the foot. To easily recall the first layer of the plantar foot muscles, you can use the acronym AFBAM. AH for abductor hallucis, FB for flexor digitorum brevis, and AM for abductor digiti minimi. To palpate the abductor hallucis, the position of the patient will be in supine, feet close to the edge of the table, with the therapist on the tested side. The palpating dominant, index, and middle finger pads of the left hand is placed at the navicular bone and uses that as the adjacent bony landmark. Then the fingers are slid down to the plantar surface of the navicular bone to get to the abductor hallucis muscle belly. From here, the patient is asked to perform toe flexion, since it is the muscle's second function aside from toe abduction. This will make the muscle feel more palpable. To palpate the flexor digitorum brevis, the patient position will be in supine, feet close to the edge of the table, with the therapist on the tested side. The right hand index and middle finger pads palpates the medial process of the calcaneal tuberosity to use that as an adjacent bony landmark. Then switches through a 3-jaw chuck hand position to palpate the flexor digitorum brevis muscle belly at the level of the midfoot plantar surface, just above the plantar fascia. The left hand thumb will be at the middle phalanges of toes 2 to 5 to resist toe flexion in order to make the muscle more palpable. To palpate the abductor digiti minimi, the patient position will be in supine with feet close to the edge of table, with the therapist on the tested side. The right hand index and middle finger are placed at the calcaneal tuberosity on the plantar lateral foot to use that as an adjacent bony landmark. From there, the fingers are moved 1 to 2 finger breaths to arrive at the muscle belly of the abductor digiti minimi muscle. The left dorsal web space will be at the lateral fifth toe to resist toe abduction or toe flexion in order to make the muscle more palpable. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Therani.